Hello, hi, it's Dr. Erica. Thank you for joining me on this particular video. I am founder and CEO of Millennium Pharmacy. Please visit my website that you see in the description box. I am presenting a new video today concerning blood pressure control, management, and also reduction of fatal and non-fatal cardiovascular disease risk events such as strokes, things like that. So we want to just make mention of the new liquid medication indicated for pediatric patients. So stay tuned to the end of the video, like, share, and subscribe, leave comments and topic suggestions. Okay, so we're going to jump into it. I'm Dr. Erica. Thank you for joining me. There is a new medication on the market. It's called KATERZIA. KATERZIA is the brand name for amlodipine calcium channel blocker, which is known to reduce hypertension. And this particular medication is 1 milligram per 1 milliliter. And usually the typical dose for lowering blood pressure in ages 6 to 17 years of age is going to be 2.5 to 5 milligrams per day. And this particular medication is tested and researched and approved just for that particular population alone. Now, the medication is indicated for that particular age group to lower hypertension. Some of the side effects may be hypotension, also a rebound effect of cardiovascular events such as exacerbation of chest pain, exacerbation of um, heart attack, things like that. So those are some of the side effects, which we expect just because this particular medication is going to work right along the heart, right along those blood vessels, going into the heart to or going away from the heart as well to make sure that adequate blood pressure is controlled, making sure that the patient is stable. So that's what we expect from this particular medication class, okay? Also, there are drug interactions to look out for if the patient is taking other control medications such as simvastatin. Simvastatin is a known medication that interacts with amlodipine. When amlodipine is at 20 milligrams, there can be a change in the simvastatin concentration in the body, so we do want to be aware of that. Also, it interacts with other medications, those medications that are cytochrome P450, enzyme related. All of those medications can interact with amlodipine's effect on that same enzyme, causing an increase in amlodipine's concentration. So in that case, amlodipine will have to be reduced as far as the amount given. Also, there are other medication drug-drug interactions to look out, like with the cyclosporin and the tacrolimus as well. Do be aware of that. Now, amlodipine has been on the market for such a long time. It's so safe, so effective. It has a long history of safety and effectiveness. And so I do give my approval and advice to you about the medication. If not, I would not make a video about it, or I would just let you know that I don't approve of it. But since it's been so effective for so long, and it's now FDA approved as a liquid form for the pediatric populations, then definitely I would suggest its use in those particular populations and for those indications. Again, it's going to help with hypertension as well as decreasing the risk of fatal and non-fatal cardiovascular disease events such as stroke, heart attack, chest pains, um, and so forth. So those patients who are dealing with severe abnormality as far as the coronary artery is concerned, use caution with amlodipine or discontinue use altogether. There may be some adverse effects, just to make mention. So I am elated to give this information and relay this information to you. It's new on the market, as you can see on the title, amlodipine or KATERZIA, and it is it's a I've always dispensed the tablet forms for adults, and so adults are usually whom I'm dispensing it for in retail setting. So it's new, and I'm sure that those pharmacists in retail now we'll be happy to go ahead and dispense it as the liquid form. So I am happy to say that and proud to say that KATERZIA 1 milligram per 1 milliliter is new to the market for ages 6 to 17. It has been studied in geriatric patients as well, but it has officially been approved for those particular patients. So I do only encourage it for pediatrics at this particular time. Now, there may be certain cases where it may be used off-label, but again, it's only FDA approved for right now for pediatrics. So I'm going to stick with the research, stick with the suggestions behind the research and analysis, and just keep it there, okay? Um, so amlodipine, again, is a calcium channel blocker. It's one of the best in its class, and it's mainly used first as a calcium channel blocker just because of its known history of efficacy. So I'm going to leave it there and allow you to research and learn more. You can visit the CDC website and the FDA approval website for more information. Please like, share, and subscribe. Leave any comment, topic suggestions that you may have. Thank you for joining me. I'm Dr. Erica, pharmacist for close to 10 years, CEO and owner of Millennium Pharmacy since 2018, and I am happy to be on YouTube as a content creator, pharmacist. Thank you for joining me. I hope to see you on the next video. Bye.